All right. Thank you again to those of you who are joining us today. This is our monthly meeting where we review our population health project and then also talk about any additional kind of areas of overlap that we can work together on. So for today's agenda, we wanted to just see who we have with us and do some introductions. We talked about at a meeting with UHC recently, just adding sort of a standing agenda item around COVID vaccination, simply because we know everyone is kind of working on that and thought it might be a good opportunity at this meeting to just share where things are and work together on those strategies as we kind of move forward. We always have some opportunity for Mco updates and updates from Ohio AAP, and then to discuss kind of practice updates on the practices that are participating in the project. So with that, we can just go around and see who is on the line. We have several folks from Ohio AAP, myself, Kristen Fluitt. I'm the Senior Quality Manager here at the chapter.
Good morning.
And then, oh, there you go.
Good morning, Liz Dawson, the Chief Operating Officer.
And I believe Dr. Cotton is on as well. Dr. Cotton, if you can hear me, if you want to unmute yourself. Um, Let me see if Dr. Cotton chatted anything in. So if you are saying anything, Dr. Cotton, we just can't hear you. I don't know if it's something with the your microphone, or I saw for a moment it looked like you were unmuted. And we will come back or let us know if you maybe log out and log back in. Sometimes that can help if there's a sound issue. All right, and do we have anyone on the line from Buckeye?
Yes, good morning. This is Susie Cook from Buckeye.
Good morning. All right, anyone on the line from CareSource? Anyone on the line from Molina?
Hi, this is Rachel from Molina. I'm a senior quality specialist.
Good morning. Anyone on the line from Paramount?
Hi, this is Kim from Paramount.
Good morning. All right, anyone on the line from UHC? Anyone that I missed in the introductions? All right, and Dr. Cotton texted me. He's having some trouble with unmuting, so he is going to try to sign back in. All right, so we will move on to kind of a time to just talk a bit about some vaccine administration strategy brainstorms. And I can, on our end, can just share some things that we are hearing from some practices. And then I know that the MCO whole team is also working on COVID vaccine quite intensely. So from Lake Health, that's a group of practices that's in this project. They were sharing with me that they really want to provide the COVID vaccine in their clinics, but are having some struggles with their administration wanting that to happen. So it's been kind of a higher level barrier. So we have been trying to sort of help them with kind of some advocacy with their administration around that. And then also one of the ideas that we also are proposing to them is that they can connect with some practices that we know that are sharing that are currently administering the vaccine and kind of get some guidance from them on how they made that happen, what their approach has been with that. I think the other thing that Liz mentioned is that we have been hearing from some practices that parents are not understanding that the co-administration sort of requirements have been removed with regard to the vaccine. So it sounds like there's still um, some knowledge gaps there for families about some of those changes. And Liz, chime in too if there are other things that you have heard from practices. But I think we just wanted to, again, on this call, share as we move forward through COVID vaccine in pediatrics, kind of sharing what we're hearing from practices and what some of the barriers and struggles are. Is anyone else having difficulty with unmuting? Because I see two messages where folks say that they aren't able to unmute.
This is Liz. I'm able to mute and unmute.
Okay.
This is Dr. Cotton. I got on. I'm good now.
Good. All right. I think Sharita may be having some difficulty with unmuting for some reason. I'm going to just send her a request and see if that helps. Are there other strategies or ideas that folks wanted to talk about? I know I also this morning was just reading an article, particularly with adolescents, how important it can be to use this as an opportunity to catch up on all vaccines. So I think helping practices think through how to do that could be really helpful in getting folks caught up before the school year starts for that age group that's already getting the vaccine.
I thought they asked a question of, have you been vaccinated in the last 2 or 3 weeks with any other vaccine?
So I think they have been asking that, but my understanding was that there is now there's no barrier to administering other vaccines with the COVID vaccine. Am I right about that?
This is Liz. Yes, that is my understanding that the 14-day co-administration guideline had been lifted.
But I think that's what sort of has been confusing for some folks that that question has been asked and is still being asked often. And so families think that their children can't get other vaccines close in proximity or at the same time.
We can create marketing copy and social media messages and things for our membership, especially with this project to pilot around those messages too, is to try to get that out as early as we can, especially with back to school visits and hopefully the ages moving down from 2 to 11 in early fall.
Are there any other kind of updates from MCOs on COVID vaccine at this point with the work that your team has been doing?
I mean, I can give a summary of some of the work. There are multiple different groups that have been established. There's a large events group and a grassroots group to try and tackle different styles of events or opportunities. There's a pharmacy group trying to activate pharmacies across the state to encourage those walk-in times and incentivize people to attend the walk-in hours with gift cards. I believe the incentive right now is a $50 gift card for the first administration of any of the vaccines. Um,
And when you say walk-in appointments, where are those appointments typically occurring?
so there's a lot of pharmacies that have opened up to walk-in instead of appointment only, but we're in a partnership with CVS specifically, and they're working on some other partnerships at this time as well.
Okay.
But what I can say, and it's something that is disheartening, it's something we're trying to figure out, is that um, the events that so we're doing two type of things: discovering existing events and trying to promote them to our members, and secondly, create events and opportunities for our members. But in both lanes, the outcomes have been most of the time, an event yields 20 to 30 at most vaccinations, and sometimes we're in the single digits for a event that occurred for a few hours. So
Okay.
we're really trying to brainstorm what to do different, how to approach it differently. Is it just target larger events to the extent of, the county fairs where you're having thousands of people come through? But I know the grassroots team is looking at targeting where the plans have we'll call it a hotspot, an area or an apartment complex where we have a large amount of members who are showing a gap in care for the vaccination, and actually do a pop-up event in their apartment complex. And even trying to find partners who are willing to administer in-home vaccinations and do outreach and schedule in-home appointments for vaccinations. So we're trying to work through different ideas and concepts, but we know as of right now, with the goal being, I don't know if it moved to 900,000, it was 600,000, it's somewhere in the very high 100,000s. With the goal being up there, we are not vaccinating enough people per week to hit that goal. So we have to continue to brainstorm ideas to um, vaccinate more members across the state of Ohio at a higher rate.
Okay.
Yeah. Barriers that we're running into that we're trying to work through. I can say that there's still, I think what you just called out regarding whether you can have other vaccinations in close proximity in time to when you get the COVID vaccine. I think there's also misunderstandings and fear around which vaccine you should get. There's a lot of hesitancy around J&J. So even though in our minds when we set up an event that we know we can't be in that site again 3 weeks later or 4 weeks later from Moderna or Pfizer, we know that the best opportunity is that J&J one shot and done, and we've vaccinated a member. We are trying to make sure, if possible, to bring at least two different strands of the vaccination to an event if the provider is able to do that. And
Okay.
then we have to have a plan for how do we do that follow-up second appointment. Where do they go? Is it
Right.
reasonable? Do they have transportation? Or are we putting up barriers by the way that we've presented it today? So working through those things, those hesitancies, but trying to have, if possible, two vaccines at each event. Trying to think of other barriers that were called out. Incentives, the process of pivoting from the date in which we were given the governor's challenge to today, uh, there's a lot of things internally and workflow that need to be developed so that we could effectively market these events. So marketing has just really been standing up in the last week or so. So we haven't been able to get marketing materials out to members in the last 30 days to drive them to events. So we're hoping that increases. Incentives, those have been a barrier, and we're working through those and trying to get the gift card incentives stood up in the next week or so. So trying to increase our reach and our ability to drive members to events with the purpose of the vaccination versus drive members to events that are, or not even drive them. People are showing up for an event that is something else, a food bank, a food market, a fair, a something along those lines, and then hoping that they also want to get the COVID vaccine because it's there. So, you know, trying to make the COVID vaccine the priority of the event, not the on the side.
Gotcha. Thank you for that update. Did anyone else want to add to that?
I think Rachel did a pretty good job of covering it. We at Paramount are doing a trial with one of our ProMedica urgent cares this week for the vaccine walk-ins, and we're calling, I think, 3,000 members, and so far we've only had 2 Medicaid members walk in. So
Okay.
it's an uphill battle, that is for sure. It's
Are these
frustrating.
cases for the vaccinations, are these all ages or are these just the pediatric groups?
This is ages 12 and up.
Okay. So
Yeah.
you're including the kids that are eligible.
Yes.
Has anyone made a effort to glom it onto the school immunizations that they're probably starting to do now too?
Not that I am aware.
I mean, because people are doing, they schedule their preschool checkups now, from now till school starts, well, till after school starts.
Yeah.
But that would be a group to focus on and be ready for, because they're going to be there for their 12 and up shots.
I know there's also, and I'm not on this team, but there's a provider incentive team. So I would think that that's what that group would be focusing on. Getting the kids to get their COVID vaccine when they come in for their other immunizations. But like I said, I'm not on that team, so I'm not positive what they're focusing on.
Yeah, and vice versa. I mean, that's kind of one of the things we're educating or sharing with members. Because I think we are hearing from a lot of primary care practices that as word is spreading about the vaccine being available for the 12 and up age group and school, getting ready to ramp up, that they are getting calls from families about getting the vaccine. Is their, their child's pediatric provider providing the vaccine? And then, again, educating families about, and by the way, Johnny missed these vaccines or should also get caught up, and it's perfectly safe to do so at the appointment that we're scheduling for your COVID vaccine. So that's kind of in primary care, I think some of um, the process that we're hearing. Like I said, I think that from most primary care providers that I've spoken with that we work with on projects, they definitely want to provide the vaccine in their clinic. I think sometimes in some larger systems, though, like Lake Health was sharing with me, that their administration actually, if they're going to provide that to patients in this age group, that it would not be in the primary care medical home, that it would be either in an urgent care in their system or in a COVID, what they were calling a COVID clinic. Um, and I think the practices were preferring or wanting to make an argument to the administration that they would prefer that those vaccines be provided in the patient's medical home, because again, there's other services that they want to also provide, a well care appointment, or catching up on other vaccines, not just administering the COVID vaccine. All right, any other comments or ideas or things that you would like us to work on related to the vaccine? All right, let me Move on. Outside of that, were there any other items or topics that our MCO partners wanted to share or update us on today? All right, so I wanted to just review a project update. Again, just as a reminder, I know we may have a few new folks who are joining us. And also, as I mentioned in my reminder email for the meeting, I know there have been some shifting of responsibilities. So if there are folks who need to be taken off the meeting or added, just send me an email and let me know that. And for our meeting in July, I'll make sure that I update everything. But we do have several Metro Health practices participating in the project, and then also our Lake Health practices that I mentioned before. So for Lake Health, we did have a recent meeting on June 10th with them. A couple of kind of the bigger items that we've been working on, they have made a lot of progress with data reporting and kind of making strides to utilize data reports and their EHR in their work, but there's still a lot to be done there. So they have been working on revising some of the reporting that for the metrics that we've been looking at for this project, taking some of those reports from being rolling totals to actually being a monthly report that they can really kind of tell if they've made some progress. And then we do not have updated data for them, so I do apologize for that. But the office manager is going to be sending April and May data by the end of this week. But that has been delayed a bit because of some of the tweaking that they've been trying to do with their report. So we also talked a lot about patient outreach interventions that they've been trialing through the project. And then again, as I mentioned to you, immunization planning, as the last 6 months of this project is really focused on immunization. And we have wanted them and recommended that they do IQIP and also some other educational activities around vaccines with our Moby and Ties education. And then, as I mentioned, a lot of their effort right now is working to try to get the ability to administer COVID vaccine in their clinics. So we talked quite a bit about that and some strategies around that. And our next meeting for them is July 3rd. So one of the things through the project that the office manager mentioned is they have been doing a postcard outreach, but really they started running into some barriers with staff because the staff actually prefers EMR reminders that do push text and voicemail because it is sort of less time consuming and cumbersome for the staff. So we talked through that a bit and also just really not sort of knowing if those interventions actually work to get folks in the door. And as I mentioned, the COVID vaccine, the office manager has submitted the application and they do want it in their practice. They do have quite a few parents who are calling them for advice, calling them with questions, wanting to know if they're going to be providing that. But their real barrier has been the administration. And that they currently have only been providing the Moderna vaccine, and that their administration has really not sort of ready for ordering. They've been having some sort of um, excess supply and some issues around that. So I also asked them because as we were talking to our colleagues at United on a meeting about the idea of pediatric providers when they provide vaccines to the 12 and up patients, would they be able to also vaccinate parents or caregivers who are there in the office? And so I wanted to hear kind of as we're talking to practices how that idea sits and what thoughts are about that. They feel like that actually the lead physician said to me that would be a hard no. And I asked sort of why, and she said, documentation and billing issues and challenges. But we are hearing from some pediatric practices that they are doing that. So I think our next step was to suggest, like I said, that they sort of network and connect, or that we may do sort of a podcast or some other type of informational kind of education opportunity for our members around how many pediatric practices are administering the COVID vaccine, and some of them are providing it as well to parents and caregivers, actually at the same time that they're vaccinating their pediatric patients. So any thoughts or questions on that information? Oh, go ahead, Dr. Cotton.
I was just going to say I had an experience where we had a supply of DTaP vaccines for adults
Uh-huh.
to parents, grandparents, or whatever, and we used the vaccine registry as our documentation.
Yep.
Billing, it was a grant, and so we were given away our cost of administering the vaccine, so we weren't charging for it, but we were. I mean, the vaccine was free. We were giving away the equipment and the time of the clinic providers.
Yeah, so I think there are ways to do it, like I said, because I know we have a group practice in the Cincinnati area that's currently doing it. So I think, if we just gave guidance and education to folks around how to do it, how to document, how to bill, and that, you're going to be, it's going to be okay that you do this. I think we could see some uptake on that. And then, as I mentioned, IQIP. So the 4 Lake Health clinics are getting that scheduled for June and July, and also scheduling Moby and Ties virtually for those months as well. And that will really launch and kick off sort of more intensive review of immunization data and work over the next 6 months of the project. And with their patient outreach interventions, I mentioned sort of about the postcards and the EMR reminders. Lake Health, when we initially worked with them, also wanted to do more social media outreach. They felt like that was something that was lacking, and that many of their patients, that was a way to engage and interact with them. So they have begun doing more of that. Each physician is doing a post one time per month in their practice, and working to sort of provide content that's relevant and timely in the summer. They're doing one on catching up and getting prepared for back to school, but that also connects the patient back to the practice. And again, the lead physician shared with me that in their first attempt to sort of do this, what she realized was the lead back was not really to their practice. It sort of led back more to the larger institution as a whole, and she just wanted to make sure that there was a connection back to the practice. So they're working on marketing to kind of get that set up in a better way. So there's some kind of tweaks to work through with that. And like I said, June was sort of a well visit catch up kind of outreach to patients. And we'll be kind of checking to see if that has some impact in terms of the well care appointments that they see. And just as a reminder, these are the metrics that we're following for Lake Health. I've kind of highlighted some of the challenges with the reporting. We really wanted to look at the first metric with flu pulled out, but they are having quite a bit of struggle with changing that report. And then metric 3, this was a new report for them that they have, again, been tweaking and revising to get it to be a true monthly report and not a rolling total. And so the office manager is rerunning that data back to January, and is supposed to have that to me by the end of this week. So these are all the charts. You saw these last month. So they have not been updated. So I just wanted to kind of make those notes. Again, with metric 1, they're continuing to use EMR push reminders. I know Andrew from Paramount shared some wonderful resources that I also shared with the practices around well visits, and then also some additional transportation information for Medicaid members. One of the other things that we are encouraging folks to do is to actually schedule the follow-up appointments in the exam room rather than kind of at checkout. Some of them are noting that they miss some folks at checkout. Folks kind of get out the door if there's busyness going on, so they're actually doing some of the scheduling actually in the exam room before the patient leaves. And then, as I mentioned, some of the patient messaging and social media outreach. Same with metric 2. As I mentioned, this is one that we're expecting April and May data at the end of this week. The metric 3 notes, that's the new report that we're getting, the monthly report rather than a rolling total. And then also metric 4 will be updated. So some of the next steps for Lake Health is sending updated data, getting those IQIP and Moby ties kind of firmly scheduled. They're reviewing some of the information that you all sent me, which I'm very grateful for, on MCO incentives, and sort of determining how they maybe can incorporate some of that into some interventions in their practice. And then, as I mentioned, networking with current practices who have had success administering the COVID vaccine, and even administering that not just with pediatric patients, but also with parents or caregivers. For Metro, I don't have as much of an update for you. We had a meeting scheduled for this Monday, but unfortunately, Dr. Teen had to reschedule that. So we are still also waiting on April and May data for them. These are some of the recent coaching recommendations that we've made to Metro. I did review this at last month's meeting. So we're kind of following up to see how these interventions have gone, and if there are some tweaks that we need to make to those. And then we have suggested to them, again, they have been having some success with the texting intervention. So we have wanted to sort of spread that to other populations. They've been using it quite a bit for lead, but we wanted to expand that again to catch up with to patients who need to catch up with immunizations and well care. And then with them as well, we've recommended doing IQIP and Moby ties, but that was something that needed to be escalated to their leadership team to see if we can progress with that. And then also a pilot that they have been doing on sort of working more intensely with a care coordinator on severely behind patients at one particular site. We wanted to kind of see if there's the ability to expand that a bit to some other sites there. So I just wanted to check in to see if there are any comments or questions on Lake Health or Metro, and the practices that we're working with, or other ideas or interventions that you would want us to pilot with them, or sort of try to get additional information or input from them on. All right, well, our next meeting is scheduled for July 21st. So I will probably early July send you kind of a data update from both of the practices so that you'll have that before our next meeting. And then if anything's come up in the meantime, please don't hesitate to reach out.
Thank you.
All right, thanks everyone.
Thank you.